Well, welcome everyone to our Benefit Clerk annual webinar. And I'm glad several of you could join us today. We'll be doing introductions for our speakers as they come up, but I just want to welcome all of you. I would have us go around the board, but I think we might eat up too much of our agenda. But please look at the names of those attending, because they are, like you, people administering benefits in their own municipality. And if misery loves company, here's your company that you can reach out to. They can reach out to you. We have a lot in common. So I'll start today talking about the year 2020, obviously an odd year, but the consortium was used a little bit differently this year than previous years. Obviously, we had a lot of COVID questions, questions regarding coverage, questions regarding testing, questions regarding FMLA and related. We don't give advice on that, by the way. But this pandemic certainly brought up a lot of healthcare issues and healthcare related issues. Furloughs and layoffs became big topics, especially looking at plan comparisons during a furlough and layoff situation, changing plans to save money when there were budget considerations. Laying off people led to COBRA notifications and questions regarding COBRA. And then the longer we stayed home and the longer we felt frustration with the pandemic, then some of those mental health questions started coming, especially for essential workers and the like. On top of it all, people are still looking for ways to remain healthy and wellness ideas and asking questions about wellness information. So it's certainly been a big year for us as far as questions and concerns centering the pandemic, and the rest of it was business as usual. So today we're going to cover a lot of things. We've changed the agenda around a little bit from our meeting that we had last week with large municipalities that do data entry directly into Excelis. This group all utilizes Jessica Hobart. For me, she's up in the upper left-hand screen, second row down if you're watching. And Jessica will be the first on the agenda today to talk about things specific to that. Last week, Excelis spoke much more about data entry into Excelis. This week, it'll be much more about Jessica. But the rest of the agenda remains the same. Only Corey, you're up first this time ahead of Excelis. So don't fall asleep. You're coming up soon. But we're also looking to share who to contact and when to contact them, how you get information, and you can always contact the consortium, and we can head you in the right direction. But if you're someone who likes to be more streamlined and go directly to the source, we will tell you how to get to that source today, and that'll be part of both PROACT and Excelis's presentations. We're also going to talk a lot about the website and navigating the website. There's a lot of information on the website, and that is helpful, should be helpful to you. We hope it's helpful to you. And we're going to point you where to look, what to find there, and how to navigate that. So we'll be on the consortium website as well. And some of you may be asking, well, why are we changing some of our contacts and our direction? The consortium has grown from 13 members in 2010 to 50 members in 2021. So as we become a larger organization, we have to operate a little bit differently. And by operating a little bit differently, we want to share that information with you so you don't get lost along the way, especially for some of you who have been here with us since the beginning. So we've prepared a PowerPoint today. And with that PowerPoint, we're just going to be going through it step by step. And I am going to close my laptop and you will lose me, but you'll still hear my voice because I have to navigate off the larger screen at this point. Okay, I want to go to I'm trying to get you just the slideshow so you don't see my notes here, but for some reason it is not letting me do that.
And we can just see the slideshow.
Oh.
A second ago we could.
Now I have no clue what I just did. Okay, can you see it now?
Yes, it's the full screen is the slideshow.
Okay, great. Okay. So today we're going to talk about consortium updates, invoicing, and plan changes. Proact will give us updates in customer care. Excelis is going to talk about account and member service. We're actually, the consortium wrap up will be at the end. Hopefully we're going to get to Excelis, wellness materials from Excelis today and other tools and resources. And although we have questions and answers at the end, as we are presenting, please either use the chat room or raise your hand. And great. Am I on mute or is that Deborah on mute? No, that's Deborah on mute. We will answer questions along the way. So feel free to ask those questions along the way. So we're going to start with some information from Jessica Hobart. But first, let me address the 2020 premium holiday. For those of you who have not heard yet, we will not be invoicing for premiums in December of 2020. We had a lower than expected claims year due to the pandemic and a lot of people putting off surgery, and as a result, our expenses are significantly lower, which has allowed us to give a premium holiday. Jessica will be talking about that premium holiday and what your invoices are going to look like momentarily. And then the other thing I just wanted to bring to your attention, we do have a new premium payment policy that is advancing from the operations committee. That premium payment policy is for anyone who goes beyond the 30 days. So the policy says you're supposed to pay your bill when it comes. You're supposed to pay your bill as it is, which Jessica will cover, I'm sure, shortly. And then if you are late for some reason, after 60 days, you will receive a letter from the consortium, and between 60 and 90 days, you will hear from the executive director. After your late 30 days, there's a 1% penalty fee, but that is now a formal policy that's been put together by the consortium. So just want you to keep that in mind as we're moving forward and as you are paying your bills, that there is a formal policy in place. So with that said, I'm going to turn it over to Jessica. And Jessica, I believe I need to stop sharing so you can share, correct?
Yes, please. Yep.
There you go.
Okay. I'm going to share. Okay. So I'm Jessica Hobart, the principal account clerk for the consortium. I'm located actually within Tompkins County Finance Department. Let me see. So with the premium holiday, your invoices will look a little different. Let's see, we are billing November for December. So a lot of you are going to be seeing this on your next invoices. The top part where your premiums usually are will be zeroed out. And then if there's any adjustments, you'll see those at the bottom, which I'm going to show you examples of those here in my presentation. Just to go through a little bit of what the bills and rosters look like. This would be the roster that Excellus sends to me that I use to then bill. I'm going to show you a different example of this too, so I could show you exactly how I came up with the numbers. So this would just be page 2. Again, it's going to list your employees with what contract type. And the contract type is either single or family. And you can find that also down here at the bottom. So contract type 1 is the only single policy. And then 2 through 5 are the different families. They split them out on here depending on if it's like an employee spouse, employee children, employee spouse and children. But they're all just family policies to us. And then you receive an email that looks similar to this. And when you open it up, it actually gives you your invoice. So let me go into Adobe here. And I think I lost mine in the invoice. So this is what you're going to receive first from me. It'll come right from my name, is the email that this will be your invoice. Exactly what it'll look like. Invoice number, when it's due, and then the amount will be here. This one's already paid, so it's 0. But so and then when you click on the invoice, it's going to open it up, and here's what's owed. So this is just going to be an example, and I used this one because it did have adjustments to look at. Second email I'll send is going to have the roster attached to it. So first page will always be the retroactive adjustments, but I skip those until the end. I'm just going to do the regular invoice first. So here's list of employees, contract type. So this is where you're going to want to look and make sure changes were made if they were supposed to. Somebody went from family to single. Are they showing up like that here on your roster? And then at the bottom, this is what I use to create the invoices. So it's just simply the single 11. So then when you look at the invoice, it's the single, and there's 11 policies. Family, there's 20. So the family, I bill for 20. Now this one had the retroactive adjustments. So they're here at the bottom. And these for your purposes, because you're billed a month ahead, don't exactly match this roster. So you always have to add another month. So when you're looking here, there's single and a family and single. So I just simply go through single first. So you want to make sure you're getting your adjustments. So she should have a credit for July, a credit for August, and then a credit for September, because this is the October bill. We've already paid September. And then Caitlin Casey is going to have a credit for August and September. And then David Griffin here is going to have a credit again for July, August, and September. So we go look at our invoice, and it's here. And then we have to do the family one, which when you look, the 5 is family, and that's a plus, so they're adding family. So we're going to add 2 for August and September. When I send these, once in a great while, QuickBooks will get quirky and not send an invoice out. So if you get this roster from me and you haven't seen the invoice come through, just let me know. I'll send the invoice out right away. Any questions? When we say pay as is, if I send this invoice and it's missing something and you want to get right back to me on it, we can make changes within the first, week or so. When we say pay as invoiced is if you know somebody's going to be off the plan, but they do not show on that roster, then I cannot give credit yet until it shows from Excelis. I just wanted to show you also. So that's invoicing, pretty simple. Any questions, of course, you can ask, but I was going to show you a little bit on the website too, where you can find for the online enrollment. So the online enrollment information is under the municipal resources, online enrollment. And here's where you're going to find your enrollment forms. Each town, village, municipality has their own. So I'm just going to pick one to pull up for right now. So the important parts on here that I really need filled out are, of course, what they're doing. Are they active? Are they retired? Are they canceling their policy? And why they're leaving. And then the two dates here, effective date and hire date, have to be filled in. You do pick the effective date. A lot of people tell me they thought the consortium does that, but you and the town and villages know your contracts. Some of them are different. Some employees might get coverage as of the first day of employment. Some might not get it until the first day of the next month. So you would know that effective date. And when people are canceling their coverage, it's very important that the effective date, if you want it to be the end of June and not go into July, that effective date is the last day of the month. If you make it July 1st, they have coverage July 1st and you're paying for the whole month because we do not prorate. So it's very important, and most of the time I do ask if it's wrong, but this date is supposed to be the last day of the month. Going through most of this, I mean, you all fill this out, of course, subscriber information. But the other important part that I get blank a lot is this number 5 right here, the other coverage information. It's very important. It is required for me to be able to enter it into Excelis. So again, as long as this is filled out, then there's no holdups getting it in. You won't have to wait an extra month possibly for that credit or addition. So those are all out on the website. One more thing. Is right over here on the left-hand side. Once you get in here under online enrollment, there's the invoicing protocol, which again, if you have any questions, I mean, you can ask me, you can ask Elin, Deborah, but in here it pretty much spells out when the rosters come in, how I do that, how long it may take for a credit or an addition to come through. But it's pretty much spelled out in here on the website. So I think that's it. I can't see if anybody had any questions on there. So I'm going to stop sharing my screen and go back in. Okay, I'm back.
Jessica, we did have one question. I answered it, but I want to double check I answered it correctly. I was told the start date is always on the 1st of the month. The only decision we make is whether we move forward or back on the start date. So I said, yes, you were talking about termination is the end of the month.
Yep.
You were always billed for a whole month. So the start date would be the 1st. And that would be up to the municipality how they determine the start date. Is it the 1st of the month following employment? Is it when the employee started? If so, you're still billed for the whole month, even if they start mid-month or something like that.
Yep. Yep. That came up. I don't remember which municipality, but it was actually in one of their contracts that they had coverage as of the first day of employment. So, but they were aware that we don't prorate that, so they do have to pay the whole month being part of the consortium.
Great. Did you have anything else, Jessica?
Nope. I think yep.
That was it. Okay, great. Do we have any other questions for Jessica? Then I will go back to sharing my screen. And we will keep moving forward as long as there aren't any questions regarding accounting. Okay. All right, so we've had a lot of questions recently. As you know, at the September board meeting, we approve premium equivalent rates for the following year. So in September, we voted on two things. One was the premium holiday we just spoke about, the zero invoice receipt for December, and then the premium equivalent rates for 2021. Now, on the whole, premium equivalent rates went up 5%, but for the metal level plans, they go up a fraction of that, and they're each different. So the Losi and Cahill do the calculations for us, and then an entire spreadsheet is put together with the premium equivalent rates. And I wanted to show you where you can find that information. So I'm gonna stop this, open this. Okay, so we're now on the consortium website, as Jessica had taken us there earlier. And when we use this is a very useful tab, the employee, retiree, and wellness information. When we go to plan information by municipality, right at the top of that section, and this will be there all year, so if you want to compare anything during the year, will be the 2021 premium equivalent rates. They are broken down in many different ways, but if you click on one of those, you can see all of the metal level plans are listed here together with the premium equivalent rates. When they're calculated, they're broken out between medical and prescription, but you are just looking at this final number, which is also right here. So a platinum plan member, individual 694.22. I feel like I'm at the eye doctor office. I think that says 186499. So these are where you find the premium equivalent rates on our website. Also under the same tab will be where you will find information about your municipality. So I'm going to use the town of Ithaca as an example. These are the plans available to employees in the town of Ithaca. Over here on the right, it tells you what prescription drug plan. And the reason it tells you the prescription drug plan over here is when we click on these benefit summary sheets momentarily, it will say contraceptives only, because your prescription drug plan is with ProAct, and the benefit summary medical plan sheets are from Excelis. So you can always figure out what your prescription drug plan is over here. You go to your benefit summary, you click on the platinum plan if that's what you're in, and here are the benefit employee facing benefit summary sheets. Now, these are almost updated for 2021. Beth has sent me a draft of all of the benefit summary sheets, and I think I'm 2/3 of the way through making sure that the changes we're going to talk about in a minute have been reflected. Once that happens, we will update the website. But if any of you are doing open enrollment meetings this week, next week, and you don't have an updated benefit summary sheet and you'd like one, please let me know immediately, and Beth and I will work on getting one specific to your location out to you, so you have this useful information when you do your open enrollment meetings. We are going to look at resolutions, and I got some feedback from last week that looking at the resolutions, it was very hard to figure out what the plan changes were specifically. So when these are posted and you want to know what your new out-of-pocket maximum or what your new deductible is, it's spelled out very easily here. But I'll also show you on the resolution, because that's what's passed and that's how any changes are made. So with that said, let's go to the resolutions and talk about plan changes that were made for 2021. So under governance, the board of directors, actions and resolutions are your top choice right there. And then you come to this page of all of the resolutions that have been passed. And we're not going to click on all of them. We will just click on resolutions that are very specific to the plans. So the first one is this resolution: approval of adjustments to the bronze, silver, and gold medal level plans. As you know, or as you may or may not know, Medicare publishes every year an actuarial calculator that to be a medal level plan, you need to be within a certain percentage of the actuarial value. And Losi and Cahill every year does that calculation for us. And then they report to the Joint Committee on Plan Structure and Design. And if we are not meeting the criteria of the actuarial value calculator, so for example, gold plan has to be 2 points above or below 80%. So if we're not within that range and we don't meet that, we need to make adjustments to the plan to help us meet that criteria. And Losi and Cahill work on the calculator and make recommendations to the Joint Committee. At that point, if there are any changes, recommendations would come from the Joint Committee and it would go specifically to the Board of Directors. So if you look at this resolution, you will see gold, silver, and bronze, and the actuarial value. So we know that we're within the calculated expected level, and the changes to the deductible that were approved at the Joint Committee and the board meeting. So this column is what the second column in, where it says 2. You know where you probably are at right now. Your deductible, if you're in the gold plan, is $1,400. That's going up to $1,500. Your family is at $2,800, going up to $3,000. And then the corresponding out of network costs as well, and those deductible and out of pocket maximums. So we have both the deductible and the out of pocket maximum on the gold, silver, and bronze plans. And these are the changes that happened due to the actuarial value calculator. So some external pressure on our medal level plans. Okay. So that was the first change that was made to our metal level plans. We then looked at the out of network scenarios, and our out of network used to be 2 times the in network. And there was some discussion that maybe we wanted to make that less of a barrier if somebody had to secure services out of the network due to a specialty or something like that. As a result, we made recommendations to out-of-pocket maximums. So this column, the deductible column, did not change. Those changes were made on the other resolution. But the, yes? Oh, I thought someone had a question. But the out-of-pocket, out-of-network changed to be only 50% higher than what what had been previous, or what am I trying to say? Then the deductible. I'm sorry, I got tongue-tied there for a second. So these are what the out-of-pocket, out-of-network maximums will be. And it's, you know, you're looking at 2 different charts, and that's why I said wait until the benefit summary comes out and it'll be pretty clear. But these are the resolutions that were passed. These are how the plans changed. And then we have some good news for you. Well, that was good news too. That was lowering out of pocket, but we added some benefits this year. We added some vision and some hearing related benefits to the metal level plans and the Medicare supplement plan. Previously, we had no hearing aid coverage, although hearing exams were covered on all plans, but the bronze plan, we did not have any hearing aids. So across the board, hearing aids are now covered at 50%, subject to deductible, and it's for one purchase every 3 years, up to a maximum of $3,500 for one pair. And that is combined whether you go in network or out of network. So we have added that hearing aid benefit. In addition to that, we added eyewear. Eye exams have been covered, but eyewear had never been covered. So now you can get, or in 2021, you can get reimbursed, $60 reimbursement for frames, lenses, and contact lenses. And that, of course, is combined for in-network and out-of-network. The Medicare supplement plan is a little bit different. Let's see. Whoops, where is that? That's on the bottom here. In that the eye exam for Medicare supplement is a $20 copay, and the eyewear is 100% allowance. The hearing aid benefit is the same benefit as the other plans. Now you'll notice for those of you in the bronze plan, there was no eye exam and no hearing exam covered previously. So those were added the same as once you hit your deductible, those would be covered at 0% coinsurance. So those are the new benefits that we have added this year. So I'll pause here to see if there's any questions. And then I will go back to our PowerPoint. And we just covered under our agenda, the board approved plan changes. And now we will move to Oh, I forgot one section. No participants in the plan. And we remove those plans from the offering. And there are some old plans that people are still in. And once those people are grandfathered in, and once we have no enrollment in those, we will not let anybody select those plans in the future. So there have been some plans. You can go back and look at that resolution of what the plans are. None of you are probably in the plans that were removed because we removed them because nobody was in them. But you will see which plans we're hanging on to, some of the indemnity and PPO plans. These are all the other changes we talked about. So there are two government mandated changes. The anthrax vaccination was covered under the Affordable Care Act, and there is now a booster, and that booster will also be covered the same way as the vaccination because it is part of the Affordable Care Act vaccination policy. So that's the first thing. And then the next is the maximum an individual can pay for insulin is $100. And I'm going to have Corey pipe in here and just tell you a few things that are specific to this government mandated benefit.
Yeah, sure. Thanks, Elon. So I think the biggest thing to remember is when we think about diabetes, there are a lot of injectable products that you take. Just remember that as of January 1st, insulin products will be capped at $100, which if you're on a copay plan, it already is. The copays don't exceed $100 for those. But there are a lot of other products that are injectable diabetes products that are not insulin that will not be subject to this mandate. So it's truly only for drugs like Humalog, Novolog, or Humulin that would be subject to this $100 mandate. And again, the biggest part of that even is on the high deductible health plans.
Good. Thank you, Corey. All right, and then the last are the changes that you make at the local level. Some of you, I am aware, have elected a plan change. Some are having more robust plans in 2021 due to negotiations. And some of you have elected a more cost-effective plan for your organization in 2021. We ask you to have those changes to us by October 15th. And I think there's one entity that is getting back to me the beginning of this week. But other than that, the reason we do that is Excelis and PROACT need to set up the new plan in their system. And then we need to scoop up all your enrollees in your old plan and move them over to the new plan for the January 1, 2021 effective date, which means employees would be getting new ID cards. We would want them to get those before January 1st. So very important that if you are making plan changes, that's why we put the October 15th date. So when employees go for services after January 1st, they show up as being covered under that new plan. Any changes, any questions regarding changes for 2021? All right. So as I said before, all of the other changes that we've discussed will come up in your benefit summaries, and those benefit summaries will be posted on the website. And we will hopefully send you out an email and say, hey, all the benefit summaries have now been updated, and you know where to go to find them. So this is the period of open enrollment. And I want to make sure we just pause for a minute and talk about the value of doing open enrollment every year. I've had people call me in March and say, hey, so-and-so wants to add their child. Well, why? Well, they forgot to enroll them, and now they need to enroll them. We can't do that under the due to healthcare legal restrictions. You can only add people twice a year. One is during open enrollment, which happens for us in November. And the other time of year is when there is a qualifying event. And Excelis will talk a little bit about qualifying events later in the presentation. But those are the only two times. And a qualifying event is a marriage, birth of a baby, a divorce, someone who you're covered under loses their coverage, a child ages out at age 26, things like that. That's a qualifying event. The other, if you want to add someone or delete someone for any reason, that's not considered a qualifying event. The only time you can do that is during open enrollment. For us, that happens during November. So we do these benefit meetings so you know what the changes are. You can update your employees on the changes. So you can make sure you speak to your employees that this is the time of year if they want to make any changes or confirm the plans that they're in. This is the time of year for them to do that. And then those changes are submitted to Jessica, so Jessica can input them into Excelis. Excelis has a blackout period in December. We always get hopeful that at the end of December, they'll open it up and we can make last minute changes. But really, in order for ID cards to be sent out for employees to have the proper coverage they need by January 1st, those changes need to be to Jessica before Thanksgiving. So Jessica can make all those changes. And the sooner the better, because as soon as Jessica receives them, she starts putting them into Excelis. And if everyone sends them to Jessica on the last day, we know there might be a little delay in the input and Excelis and ProAct getting the information. So you all send to Jessica. Jessica updates Excelis. Excelis does an update to ProAct, and then Excelis ID cards and ProAct ID cards are sent out. So don't forget, there's two sets of ID cards, and there's a little lag between Excelis and ProAct because Excelis updates the information to ProAct, then ProAct receives it and sends out their ID cards. So that's open enrollment, and that's why we talk about any benefit administration issues during this time of year, so you are prepared for that and can publicize the changes and let people know if you offer more than one plan and they can change from one type of plan to another. I know many of you don't these days. That's when you can make that change during November. As I discussed earlier, I received a lot of questions this year on COBRA. People were thinking about laying off, furlough, all types of different scenarios. And also some people just left their employers, and now employers were faced with, uh-oh, what do I do? How do I administer COBRA? Now, some of you are lucky, you have a COBRA administrator. It's an outside resource. You're paying additional money for that administrator to manage COBRA for you. Those are some of our larger municipalities. But if you're a smaller municipality, you don't have a COBRA administrator, and someone has dropped off the plan and you need to notify them, and you need to offer COBRA. We've kind of put together a little COBRA toolkit from the consortium, and it's, what is COBRA? It's just questions and answers regarding COBRA, and we can send that to you. But later on, you will also see the Excelis administrator guide references COBRA and what you need to do regarding COBRA. The Excelis's administrator guide is on our website, so we can find that there as well. And then as a last resort, you can always call the New York State Department because some of you are administrating COBRA based on old rules and regulations. It used to be only 18 months for COBRA availability. And now a lot of, due to New York State changing their law, many employees are eligible for 36 months worth of COBRA continuation. But that's not for us to determine for your entity. So you need to do your own research. We can certainly point you in the right direction. But it's good to know the facts about COBRA, especially if you are laying off, when to give notice, how soon to give notice. And then Excelis will talk about how they administer that and what kind of grace period and window they give you to make those changes in this system. Beneficiary audit. We're going to probably in the next 6 months do a beneficiary audit. We haven't done one as a consortium in a while overall. And I'm just giving you a heads up now that we will be asking you, especially those of you who have been with us 10 years and haven't looked at your files within 10 years, to make sure the people who have married family coverage, that they're still married and they're still eligible to be covering their spouse, to make sure that there aren't children from a domestic partner who's no longer a domestic partner and hasn't been for 5 years, that those children are off the family plan. Things like that we look for in the beneficiary audit. I wasn't here the last time the audit was done, but there were thousands and thousands of dollars spent in benefits to dependents that were not eligible to be covered, and nobody noticed it. They just kept processing family plan. They weren't really looking at who the dependents were on those family plans. But when you sit down and you do the audit and you confirm who all the dependents are, it's a good thing for the consortium, but it's also a good thing for your premiums at your location, to make sure you're not paying for benefits for people who otherwise wouldn't be on the plan. So that's a quick update from the consortium about things that have changed. We'll come back again at the end to talk a little bit more about our wellness program and some of the things we're doing with wellness in partnership with Jason from Excelis. But now I'm going to turn over my screen and presentation to Corey Prashaw from ProAct, and he'll be sharing with you about pharmacy benefit administration.
Elin, did you want to stop sharing as well?
I thought I did.
Oh, I guess that was.
I'm sorry. I'm sorry, Corey. You're right. I want to keep sharing. Go ahead.
That's all right. Yeah, so thanks everyone. I know quite a few of you know me, but I'm Corey from ProAct. I serve as the account manager that works with Elin and her great team to work through some of the problems that exist in the consortium and administering the pharmacy benefits. So first and foremost, how do you get a hold of us? More often than not, I would say 99% of things that come to me, that come to my team, can be handled all through our help desk, which is available 24 hours a day, 7 days a week. At the number here, you can also find it on the enrollment packet that members receive when they sign up for the consortium's coverage. And it is on the ID card, the ProAct ID card. So a couple highlights. We promise an agent, a live representative from either Syracuse, New York or Governor, New York, on the phone with one of your members in 20 seconds or less. And again, the big thing, if I could give any piece of information that would help everyone, I think that's instructing people to call our help desk before they leave the pharmacy, right? So I think so often we run into these situations in which a member goes to the pharmacy, they have an issue, whether that's they need a prior authorization, step therapy, somebody's date of birth is wrong, any of those, they come back, they talk to you because they trust you, and you reach out to me, or you even reach out to the help desk and find out that, oh, it could have been fixed in 10 or 30 seconds. And that person now has to go back to the pharmacy, pick up their prescription. All of that can be managed right at the pharmacy. If it can't, then certainly we want to engage the right people to make sure that people are getting their prescriptions. But, anything from, a general rejection at the pharmacy to benefit questions, right? So if people are going to try some new drugs, or they're talking with the doctor about different medications, we can certainly answer any questions that people have. Again, 24 hours a day, 7 days a week. We do not close for any even major holidays. So we are available to people. The online resources, I will go over the website in a little bit more depth after this presentation, but on the website, you can find a ton of great things. Claim summary, which accounts for all prescription drug claims that you got at a pharmacy. The drug cost comparison feature, which is a great tool for people on high deductible health plans. You're able to kind of shop around. You can choose what area you're in and see at other pharmacies how much your drug would have costed you. From there, you can kind of pick and choose if you'd like. You'd be surprised at how many times you can find a $100 drug over here at, say, Walgreens, and then maybe Kinney Drugs or Rite Aid or CVS could have that same drug for $20, $50, $80 less sometimes. So the pharmacy finder, which I do say a lot of the time is not necessarily super helpful, because our pharmacy network is extremely expansive. You'd be hard pressed to find a pharmacy that's not in our network. You can update your account information on the website based on a lot of it being the mail order pharmacy, your address, and some of your payment information. You can find a temporary ID card, and you can also look at the formulary, which I think is really helpful when you're actually sitting at the doctor's office and they're talking to you about your medications. And you may be, your doctor may be looking to actually change your medication or add a medication to your therapy. You can actually pull up the formulary and look and say, okay, ProAct says that this is the least expensive version of that drug that I should take for, say, my blood pressure or cholesterol or diabetes. Here, just really quickly, we do point this out. The mobile app has a lot of the same capabilities as the website. A lot of people are more mobile. They're more likely to use an app. I think it's much more useful for people that use the mail order pharmacy. But when you do try to find the app on either the Google Play Store for Android or the Apple for iPhones, search ProAct space RX. So that's one thing people couldn't find us. I know if you type in just ProAct, you get kind of pulled all over the place on the internet. The Proactive face wash, there's a bunch of other things that share a similar start to us. But ProAct space RX is how you're going to find us on the App Store. The mail order pharmacy. So one thing that's available to every member that's covered under the consortium is the mail order pharmacy, which is based right here in Gouverneur, New York. It's available in a way that gives members access to month supplies to their prescription drugs. Now, this is for maintenance medications, right? So drugs that you're taking every single day routinely for things like blood pressure, diabetes, cholesterol. Those are the big ones, right? It's shipped from our facility straight to your door. There is an automatic refill component of that as well. You can sign up for it as voluntary, and mail order is voluntary, right? So we're seeing a large influx of people that are just flat out more interested in mail order now than ever. People are not trying to leave their homes, if they don't have to. And this makes it so, one, you're paying less oftentimes if you're in a copay plan. you pay 2 30-day copays rather than 3. So you may pay $30 over the course of 3 months for your, say, Lipitor, your blood pressure medication. At the mail order, you may pay $20 and you get that same 90 days that you would have gotten otherwise. So a little bit of savings there, as well as the convenience of having your prescription straight to your door. So signing up, I always recommend you either go to the website or you give us a call. If you give us a call, we'll actually reach directly out to your doctor for a new prescription for you. So you're able to get new prescription that's going to last you hopefully a whole year, and then we can send that out at regular intervals. And last but not, oh, sorry, we have another slide here. Yeah, Elin, if you want to just bump that straight forward. One more. There we go. And last but not least, the International Mail Order Pharmacy, CanRx. So for those of you who don't know, CanRx is similar to that of our mail order pharmacy. CanRx is an international mail order pharmacy. So what they do is they work with members directly to find prescription drugs for them in tier 1 countries. So a tier 1 country is a country designated by our Congress to be safe. In those countries now are New Zealand, Ireland, the UK, Canada, and Australia. CanRx will find the same medication that you get here in the US. They'll go to those countries where oftentimes the costs are between 50 and 70% less expensive than they would be here in the United States. For that reason, because they're so much less expensive, CanRx actually offers those same drugs that you may pay $50, $70, $100 for here in the US. They may pay $0 for those same prescriptions for a 90-day supply. Again, CanRx is really great. They reach out to members proactively. So they say, hey, Corey, I know you just got your prescription, say 2.5 months ago. Are you still taking that prescription? If so, do you want us to send out another fill of that? So really, you don't have an option to run out unless there's, of course, an issue where you don't get a prescription, which we could run into anywhere. CanRx is signed up for most easily, I think, by calling them as well. They will need a new prescription. That prescription will need to be either faxed or mailed directly to CanRx. And CanRx has a shorter list of drugs in which they fill. They're still for maintenance type medications, but they do not fill for any controlled substances, anything that needs to be refrigerated, or anything that's like a precursor that could be used to make another drug. So that's kind of the international mail order piece. You can go to canrxsavings.com or canrxsavingsprogram.com, find the formulary, the list of drugs that are filled. And there's also a great link to that on the consortium's website as well.
All right, that's your last slide. Do you want to go to do your web? Do you want me to stop sharing?
Yeah, I'll take over. The website.
I am.
Oh, back down. Here we go. Okay. So here's the website. You're going to look at it. It's the proactrx.com. The login, I have a test member here, but this is where you'd pop in your user information. Signing up, it's very easy. You do need your prescription ID card. You'll need your member ID from that. But I'm going to click login. Here you'll see that we have my information, or the card holders, the test members information here. Name, the relationship to that. You'll have the family listed here, as well as member IDs. It'll pop up here, your formulary. We do have a few different formularies, so it'll link up to what formulary you follow, which will actually also show you things like if that drug needs a prior authorization, step therapy, if it's subject to things like quantity limits, where we kind of hold back things like opioids with our opioid management program. All that information is right there on the formulary. So here we can click on claims history. I won't, because there is no claims history for this test member. But here you can also print a temporary ID card. So you click on that, and that'll give you all the information you need to take to the pharmacy. Or you could even take a picture of that. I've seen a lot of times where you click on this screen, and then you know, mom or dad will take a picture of that, text it to their kid that's in college. They can take that and show the picture right to their pharmacist at, you know, wherever they are, the pharmacy of their choice, just so they can get their prescription for those one-off type of things. And you don't think to send a kid to college with a prescription ID card. Outside of that, we have, again, that drug pricing tool, which I will click on. I won't go through just because it does take a second. There are a couple of things that you need to click through because of how specific it is. So you essentially would choose your drug, which has the strength and everything. You could choose specific pharmacies, or you can give an area. So I could type in my zip code and say within 10 miles, 20 miles, 50 miles. You can pick your physician, which shouldn't make a difference, not in the consortium's benefit. And then how many you get. So are you getting one a day for 30 days, or are you getting, you know, 3 per day? After you click through that, it'll actually go through the exercise of running a live claim against our system to see exactly what would happen at that very given second. Again, incredibly important, especially as some of you guys may know, that drug prices change on a daily basis. So really having this tool available to people that are on, I'll say, consumer-driven plans is more important now than ever, I think. So going back from there, we have the formulary lookup again. You could just as easily get to that here by clicking on the formulary and then the pharmacy finder, which again, I think you'd be hard pressed to find a pharmacy that's actually not in the network. The next tab that I think is important here is the mail order pharmacy. So if you do decide that you want to use the mail order pharmacy, you can click through any number of these tabs. The My Prescriptions, that's going to be where you actually put where your prescriptions are held. So you can see if you're on 3 different medications that you're using at mail order, which I will say that for anything to show up here, mail order needs a prescription. So just because you go and use a retail pharmacy like Kinney, CVS, Walgreens, Rite Aid, just because you use that, those prescriptions will not show up in this tab. You'll need a prescription sent to our pharmacy for us to view this. And from this, you can actually click and refill your prescriptions. Just as easy as that. It's also available from the app. The My Address is important for your retirees, I think, especially this time of year. They're heading down south, a lot of them. They can update their address to say, okay, well, I'm heading back to, say, Florida. I better change my address so that my upcoming prescription gets sent to Florida and not to the New York address. The enroll prescription, this would be for automatic refill. You have a chance to, here you can enroll individual prescriptions. So say, you know that over the next couple of months, you might come off of a drug, but the other 2 prescriptions you take, there's no signs that you're going to stop taking them. You might enroll 2 out of 3. The automatic refill button is how you enroll all of your drugs and potentially future drugs into that automatic refill program. The My Orders will show you, similar to the way if you order Domino's Pizza, it'll kind of show you where they are in fulfillment and if they've shipped. The tracking messages will show up here, as well as if you opt into it on your cell phone, they'll send you a text or an email when your medication shipped with the tracking information so that you can actually find those and figure out when they're going to be there. The payment methods is, of course, the payment, where you can add or remove different credit cards, your HSAs, your HRAs, things of that nature. And last but not least, the My Resources, which at this given moment is full of great information around diabetes. So if I click on this, there's a great infographic here that may have been posted by Deborah and Elon to the consortium's newsletters, but there's a ton of other information on here. I'm certainly not going to go through each of them. Ron, our clinical account director, pours a ton of time into creating these documents. Does a great job. So all great information, things, you know, basically relating to diabetes. So, Elin, I'll unless there's any questions, I'll kick it back over to you.
Are there any questions for Corey? This group is a really easy group. I'm going to have to ask you guys to do some reactions in the reaction button to let me know you're all still out there. So if you can send us a thumbs up or give applause for Corey. All right, great. I see some are coming through. Thank you. Thanks for letting us know you're still out there. Great. Thanks a lot. Appreciate that.
Thanks, everyone.
Thank you, Corey. We will continue on with our presentation. And at this point, I would like to introduce Beth Miller, our account manager, who's been with the consortium since day one. So many of you think she actually is the consortium. So I'm going to introduce Beth, and then Beth will introduce her team of Excelis experts, and we will take it from there. Don't forget you're on mute, Beth.
I was just looking for that button. Thank you. Well, happy Monday, everyone. I just wanted to say I'm super glad that we were able to get together. It has been a most unusual year, to say the least. So today, really, what we wanted to get across is to help you navigate Excelis and walk through some questions and where to find answers for things that may come up from time to time. So as we start to go through the agenda, and you can start clicking through, Deborah. Just really a quick overview. Wanted to talk about Excelis, Blue Cross Blue Shield, what we're doing for our business resilience plan, and where we stand from working remotely. As you can see, this is not my office. It's a bedroom. So I am working from home, but fully capable of performing all my job functions. So been lucky with that. Wanted to provide some COVID updates, and then also talk about account management in our customer care unit. And then I'll be fielding it over to Eric Kohler, who will get into the nuts and bolts of our membership and billing procedures and guidelines that will assist you through the months to come. So with that, we'll keep clicking through. As you know, COVID hit early, mid-March about. We were immediately advised that we will be working from home. There was no break in connectivity. We're all 100% working from home. The plan right now is we will continue until after the new year. We have upper management assessing where we are with the pandemic and how we're going to proceed as an organization. So as you know, some of you may be back to work, some of you may be part-time, and some of you may be like Terry and myself and Eric working 100% from home. All I can say is we are all in this together. This has been a most unusual year. Everyone has been extremely patient, and I appreciate it. Technology has been fun. We're all working through it. And as you can tell, we're all getting a chuckle when we say, you're on mute, you're on mute. So we laugh about that one. To get through a call without that comment is quite amazing. So right now, as you know, we are in the state of emergency still with COVID-19. And as you can continue on, flip through on our website. The most important thing is understanding where we are. Things are changing rapidly. We've had to work with our provider community on how to bill COVID testing, services, treatment, and we have a slew of information that is updated as things change, because it is a changing array of information that's coming at us. So when you go to the Excelis Blue Cross Blue Shield website, you can sign on, and right in the middle, you will see a link that goes right to stay informed about the coronavirus. Lots of good resources there. It talks about the testing and coverage and the policy. It talks about member supports, highlights of benefits. There's also a business and broker tab that also has a slew of information. I'm going to ask a quick question. Has anyone gone out to our website to bounce around regarding the COVID? You can raise your hand. No feedback?
I have, Beth.
Oh, good, good. Because there is a lot of information. You may be asked if you have a member or have a member's dependent who has to be tested or may have symptoms their doctor's recommending, you can go right out there and find additional information. So
No, Beth, we did get a comment that some people have not been to that website. One of the questions that we do get asked the most is about volunteer testing. So you're not showing any symptoms, but you are in a position where you think you're at risk and you want to go and be tested, or your employer says to you, every 2 weeks you need to be tested, something like that. Are those benefits covered? And that is the one link that I send out on a regular basis to members, is the link to that website saying that if you are not showing symptoms, testing is not covered. Now, I'm sure several of you could raise your hand and say, but I know someone's son who is going to travel and they got tested and it was covered. And I know someone who went to camp and they got tested and it was covered. It is true. There are a lot of varying different degrees of how COVID experiences have been experienced. And that's because this is such a new uncharted territory. And all of these codes are brand new, which means your doctor's office has to put the right code in. Excelis has to know what code they're paying off of. Excelis would have had to put it in the system to say a certain thing. And, you know, it's a lot of moving pieces. So yes, there are some people who may have had coverage that probably shouldn't have for a testing, and vice versa, where people have had to question why a benefit was covered or wasn't covered. But we have as a consortium tested at least 850 plus people now, and it's averaging about $350 plus dollars for those tests to happen. So even though people are paying $10 copays or whatever when they're getting tested, it's quite pricey to be tested. So when a municipality is thinking of having their police department tested every week or every other week. Those are tests that aren't covered, and you can see the cost that starts adding up regarding COVID testing. So that's not an opinion on whether you should or should not test. It's please do your research, be aware how much that would cost your municipality. There are also some municipalities that have received county funding from FEMA to do some of that essential worker testing that is outside the consortium. So there is some COVID testing that is covered through community county resources, and that's outside of the consortium. So there's a lot bundled up in COVID testing and the COVID coding and things like that. So don't hesitate to call myself. And now Beth's going to tell you how to contact others as well with additional questions.
Yeah. Thank you, Elin. You are correct. Lots of information. However, if you have a member coming to you directly, I always encourage you, instead of being the one to have all the answers, help your members help themselves. And that is by advising them to call the number on the back of their identification card, or simply going to the website themselves. They may find a lot of information and come back and go, wow, there was a ton of information out on the website, or I got to speak to somebody in customer care who was extremely helpful. They walked me through whether the provider was participating, how the test would be covered, and what circumstances. So lots of information in how to navigate our system. There's also Terry Godfrey, our strategic account service consultant, and myself. We are also available. Again, I said these are challenging times. We are working from home, however, have our phones directed to the system so we can pick up calls. It comes in as an email. But remember, if you don't know the answer, it's not always for you to find it. Sometimes a member has to find their own specific question, because they may say something like, oh, I'm going in for surgery. Well, yes, pretty much surgery is covered. However, you don't know if they're going to surgery in Syracuse or surgery in another state, if they're going to a participating provider, a non-participating provider, if the surgery is considered experimental. So it's always good to let the experts quote the benefit by calling into customer care. They have access to tools and resources where they can check the benefits. The phone calls are recorded for quality control measures. And it's just a safe way to leave you out of the loop and let you do your job on things that you need to focus on as a healthcare administrator for your plan. And then again, there's our customer service hours. They operate Monday through Thursday, 8 to 5, and Friday, 9 to 5. Our website, again, saying lots of information right at their fingertips. They can pull up information right on our mobile app, with which Jason will get into and walk you through a presentation. They can view benefit summaries. They can check deductibles and claims. They can also save their monthly health statements right to their account. So if they want to go into a paperless information, they can do that in this day and age with our digital strategies that we have. And with that, I will continue to turn it over to Eric Kohler. He is our Director of Membership and Billing, and he will walk you through some of the questions that may come up when you're adding and changing or terming someone and filling out the applications for enrollment with healthcare. Thank you. Any questions for me? Okay, thank you. Eric, this is all you.
Hello, good morning. Okay, we kind of talked a little bit about some of these things I'm going to discuss a little bit earlier on the call. So we'll hop through the first few slides probably pretty quickly, but generally there's three times for our standard practices when you can enroll throughout the year. And the first is really the initial enrollment opportunity. And that's going to be when someone's newly hired, rehired, or there's a newly eligible dependent, marriage, birth, so a newborn, adoption of a child, or in some cases, a qualified medical child support order, which there's some additional paperwork that goes with that one and some determinations on if the order is qualified. And we'll have a screenshot at the end of the presentation about that additional form that's needed. But those are really the initial enrollment opportunities that are pretty standard practice today. And then open enrollment. So like we talked about earlier, that's really the one time every year that anyone who didn't have coverage in the past or wants to hop on the plan can elect coverage, and that's January 1st. So it's coming up. November's the open enrollment period for January 1st enrollment, and we've talked about the importance of getting that information and paperwork in as quickly as possible to make sure that everyone has their benefits that they signed up for and their ID cards by January 1st. So that's when benefit changes are generally restricted to that open enrollment period as well. If they've declined coverage in the past or disenrolled and waived their coverage and they want to hop back on, that's the January 1st effective date, and now is the time to do that. And the third, so qualifying event is kind of the event that leads to a special open enrollment period. So they're kind of used to signal or talk about the same thing. So a qualifying event is the event that gives rise to a special enrollment period. So you might qualify that throughout the year for this. Examples: involuntary loss of coverage, aging off a parent's plan if an employee has coverage to their parent, and they lose that coverage because they've reached the maximum age under healthcare reform. That's generally 26. So they reach that maximum age, it's considered an involuntary loss of coverage. So then they could elect coverage through their employer group because they've lost coverage and it was really through no choice of their own. A new dependent, so that's a newborn example there. A former dependent might regain eligibility for coverage. Some network limitations, moving in and out of the service area, could also give rise to a special enrollment period where they could hop back on the plan. Loss of eligibility for a government program such as Medicaid. So if someone was on a Medicaid program and they lose eligibility, there is a special enrollment period created for that as well. Some examples of events that do not create a special enrollment period. So voluntary loss of coverage, if someone just says that they no longer want to participate in the plan and want to cancel their coverage and sign up through somewhere else, that isn't considered an event for a special enrollment, and they'd have to wait until the open enrollment period of January 1st. Early termination of COBRA due to non-payment. So if someone stops paying their COBRA premiums and they get canceled for non-payment, that's not a qualifying event to hop on an employer-sponsored plan. And then there's some other detailed examples about, contributions and changing but not ceasing contributions. So if you have any questions, that's what Terry, Beth, and I are here. There's always some scenarios that I have a couple FAQs I can touch on at the end, but just some scenarios that always come up. We're happy to help and work through them together. Example of ineligible subscribers. So contract employees or contractors and temporary employees would not be considered eligible subscribers on the plan. Examples of eligible dependents. So a married spouse, the children of a subscriber, whether they're natural children, added upon birth, open enrollment, or a qualifying event. Stepchildren are eligible dependents. Proposed adoptive children and adopted children. So there's different criteria for each of those scenarios. Those are detailed in our group administrator guide, which we made reference to earlier. And we're working on a new version for this coming open enrollment that will have some updated information. And once that gets rolled out, we'll share with everyone on this call and the other calls as well. So in the process of adopting a child, or once the adoption is completed, adopted children are generally eligible dependents. Legal guardianship too. So if you have legal guardianship, there's some differences between custody and legal guardianship. So legal guardianship, if you have that of an eligible dependent, they're eligible for the plan as well. And then adult dependents, so adult disabled dependents and domestic partners as well. With the adult disabled dependents, there is a separate form that's required, and those do go to a medical director for review. So that form is a little bit lengthy because it does go for an MD review, and there's some clinical documentation that's needed. So if the maximum age is 26 and someone's reaching that max age, but they're an adult dependent that's not capable of sustaining self-employment, those do go for med review, and there's that additional form. And the timeline there, it's within 31 days of aging off the plan that we need to start that process. So there is some time sensitivity as well. In earlier calls, we talked about the notifications that go out. So if anyone had questions, we do send notifications to the individual member groups and summaries of people aging off, so we can get that information in the paperwork process started as quickly as we can, so there's no lapse or in coverage. Ineligible dependents, so a former spouse, once a divorce is completed, it is important to get that former spouse off the plan as quickly as possible. There's often claims utilizations and things like that, so we want to stop that and cancel ineligible dependents as timely as possible. So children over the contract age limit, our system automatically ages off. So you might add a newborn now or in the future, and our system will automatically age them off 26 years in the future, so that we take care of that reaching the contract age limit automatically. Grandchildren are considered ineligible dependents unless the grandparent adopts or becomes the legal guardian of the grandchild. So in those cases, grandchildren are under the contract maximum age of 26, and if they've legally adopted or become the legal guardian, a grandparent can add the grandchildren to the policy.
Eric, this
Yeah.
is Beth. Sometimes we get questions from members who ask about, we're getting a divorce and I want to take my spouse off the coverage. What would you advise?
Before the divorce has been finalized?
Correct. So they're maybe it's a hostile situation and they're frustrated and they're mad or something, and they say, I want them off my policy, but they're still going through the divorce.
So that's a delicate situation. I would generally probably advise to consult with legal counsel, because there could be some ramifications there if you prematurely cancel some's coverage. I could ask our underwriting teams if they have any thoughts on that. But generally what we look for is, if there's paperwork involved, it would be, the correct date to cancel someone due to divorce would be the date that the county clerk files the paperwork, because that's really the official, the judgment for divorce might be done in advance, but until the county clerk kind of stamps that paperwork and files it, that's the date through our talks with internal underwriting and legal counsel that we look to for canceling a divorce, is the date that the county clerk stamps and files the paperwork into the county system.
Okay, good, because that's what in the past we have said, is that people should hold off until the divorce is final to take them off the policy. And then another clarification that I just want to make sure, because things happen on the billing side with Jessica. So if a member has a dependent and they have a family plan and it's only the employee and the dependent, and they end up aging off, we will automatically terminate them in our system because they're 26, but it doesn't go back and change from family to individual. So the town or the village needs to make sure that they change the type of coverage from family to individual, so Jessica can do proper billing.
So thank you, Beth, because that was one of our questions. Did you say we have to fill out paperwork if a child ages out? So the child will age out automatically through the Excelis system, which will notify ProAct. So they will no longer have benefits, but you will continue to get billed at the different level unless you send your paperwork into Jessica. So you will need to notify Jessica that the person is aging out. Now, Beth, we had this question with our last group. I know some of the larger groups receive reports of the aging out. The municipalities that are doing data entry through Jessica, will Jessica receive a report that people are aging out? And so the entity knows to have them do the paperwork and change from family to single if that would be the case. Beth's on mute again.
Yeah. Terry, I'm going to refer to you at that question. You're on mute.
Unmute, Terry.
Okay, there we are. Each individual person should be notified with our age off reports. So, and when I say person, my apologies, I mean each individual municipality should be receiving those reports. Was that the question?
Yes, and do those reports go to Jessica? Because this is the group that inputs through Jessica.
They've never been set up to go directly to Jessica, but we can do that.
No, I'm just clarifying. I
Okay,
want
no,
the yeah, otherwise the municipality doesn't know when to do the paperwork. So if you're notifying them, if you're notifying them directly, then they will know when a child is aging out. When that child ages out, they should fill out a new application canceling the coverage. And if it's someone with only one child and is moving to an individual policy, they should change from a family policy to a single policy. For myself, my son aged out, my daughter's still on, I'm still paying the higher premium. So it's not as, it's kind of moot for me, but for some people, this is the time when they go from a family plan to an individual plan. All right,
Yes,
so that's it, Terry, thank you.
Yes, and that's important for everyone to note that, as Beth brought up and Elin just mentioned, you want to make sure that you're making that request premium than you should be.
Okay, great.
Question then, because I don't change people from family to individual, I would remove the dependent in there, but you're saying they should already be terminated because Excelis does that on their end automatically.
Correct, but our system does not change the tier. We only automatically terminate the dependent. So if you were paying for a higher tier of policy, say a family policy, you would want to make sure that you're indicating that the tier needs to be changed from family to individual. Otherwise, you're probably paying a more significant premium.
I don't change the tier.
The location does.
Right. The municipality should ultimately be telling you, Jessica, that this dependent is no longer eligible and the tier should be, I guess, maybe, that's a good question now that you're pointing that out. Maybe they should be telling you that. Can we get some feedback from the individual municipalities as to how they're changing that tier from family to individual if they're not notifying Jessica and she's not doing it?
I just don't understand how that's not happening. If there's only, we're saying there's only one dependent on with like one parent. So one parent is the employee and there's a dependent. It automatically happens that the dependent comes off when they turn 26.
That's
what
correct.
I'm saying. So why wouldn't that change to an individual policy?
Our system Our system does not automatically change that because we have different tiers of coverage. So you could have groups that have a family, a 2-person, subscriber and dependent. So our system isn't going to automatically change a policy from family to individual. That is required by each municipality, or in this case, you, Jessica, to let us know.
And this is the way I always think about that. What happens is our system can put a termination date a few months in advance, so the member can't have claims hit our system. But when you change a tier structure from individual to family or vice versa, that is a financial change. And that is something a system can't automatically do. It has to come from the group because it's a financial change. So kind of think of it that way. It's a process that we can stop the claims that come in our system by saying this person, individual child, aged off, and we have a termination date next to his coverage. It's a date, but it doesn't change the financial step of what you're paying to the consortium.
So
Does that help?
Beth, my presentation here froze for a second, but I believe I was looking in the chat and it said we never had that situation. So on our current claims processing system, the Excelis invoice, I believe, should update the premium rate billed every month. So it sounds like that's what we're seeing on our legacy system for dental. It was different. So I'm wondering if that's the difference that we're seeing. Whereas our legacy system for dental, it used to not change the tier, but on our current system, since we've now completed the migration, I believe the Excelis invoices should be adjusting each month, and there is no manual tier change needed. So that seems like what it could be, but I'm just trying to read into the situation a little bit to see. But it seems like it's happening on the Excelis invoices automatically.
Great.
Right.
If you guys could confirm that and get back to me. So if we do need to set up a system where we're notifying Jessica, that would be great. So we'll assume that it's happening, but please confirm that with me. And then we will notify the group if we need to process those claims any differently. Thanks, Eric.
Yep, and if there's ever a need for any reporting to Terry, Beth, and I can work on that. Like if someone did need to receive a report of aging off and things like that, we can work through that. The only time so I think in a nutshell for that question, does Excelis require paperwork when a child ages out? The answer is no, and unless they're applying for a disabled dependent status, then we would require paperwork within 31 days of aging off. So these are the notices that go out. Approaching maximum age notices will be issued to the subscriber as well as a group level summary. So if you're not receiving those, you can check with Beth, Terry, and I, and we'll research what address those are being mailed to and where they're going. So probationary period at the time of new hire, this is just if your municipality has a waiting period for new hires, is a probationary period is really just the time that someone has to wait for coverage when they're first hired. So healthcare reform, a maximum of 90 days for medical products is the most that someone could make a new hire wait for health insurance coverage. COBRA continuation. So I won't go too deep into this, but there's a COBRA law, which is a federal law, and then there's the New York State continuation coverage, which in some cases might carry some continuation benefits to 36 months as opposed to the federal 18. But a lot of it is derived from who's losing eligibility under the employer-sponsored plan and why they're losing coverage, which would determine the length of COBRA, which is continuation of coverage. So it's really, you have to be enrolled into the product and continue your eligibility in the product in the plan that you had prior to being eligible for COBRA. So really it's continuation of the same plan that they had. It's not an eligibility change or opportunity to change benefits to go into a new plan. It's really continuing what you have, unless there's a subsequent open enrollment period or special event that would lead to a benefit change opportunity. So COBRA is really continuation of the plan. Retroactivity timeframes. So we have up to 120 calendar days to submit retroactivity. Generally, our standard practice or best practice is really to get it in as soon as you can. So within 30 days is always the most ideal to prevent retroactive updates and billing debits and credits. So every municipality bills on a certain day of the month. So if there's a change that comes through after that date, it won't be reflected until a future invoice. But retroactivity, we do have up to 120 calendar days to submit. Kind of, I don't want to say have no questions asked, but without having to go through a special process for something that goes beyond 120 calendar days. So if you do have something where the effective date goes further back than 120 calendar days, Terry would have to work through a retroactive review process with our underwriting team to get that approved. So really best practices with, have that 30-day time frame in your mind, and then knowing that we can fall back on 120 calendar days of retroactivity. Anything more would require a special review process. The exception on there is COBRA. So we have extended timeframes just for COBRA eligibility to alert us that there's someone eligible for COBRA. If it's a subscriber event, we have 179 days or a total of 239 days that we allow for COBRA retroactivity, just because there's so many moving pieces that the COBRA administrator has to alert the participant that they're eligible, premium collections, and things of that nature. So we do allow a more extensive time frame for COBRA retroactivity than just the standard 120 days. And billing, it's always important to pay as billed and keep up with the invoices to make sure that we're not paying premium for someone that's ineligible and vice versa. Medicare, this slide's just a quick overview, so it'll be out in the slide deck when we send it, but it just gives an overview of what the different parts of Medicare are, A, B, C, and D. Most commonly, we see Part A and Part B. Most people will have, and that's what we coordinate the benefits with.
So I did have a question earlier today, and I think the person who asked it is on the presentation with us. So you have somebody that is eligible for benefits with your municipality. So they're a full-time working employee eligible for benefits. They have signed up for Medicare because they're 65 plus. Now we want to know who's going to pay first and second. So if an employee is currently active and working and they are older than age 65, the consortium plan, so the Blue Cross Blue Shield, pays first. And then Medicare would pay second. One of the things that's very confusing about becoming a member of the consortium is a lot of municipalities used to follow the under 20 rule. So if there were under 20 employees, you went by a certain set of rules. When you are part of the consortium, you are part of a larger organization, and not all of those 20 under employee rules are applicable to you, including this Medicare rule. So Medicare under the consortium for an active 65 plus year old employee pays first, and then Medicare would pay as a second.
All right.
So is that, if there's any other questions regarding Medicare, either put them in the chat room or raise your hand and come on in. Okay, here we go. Are you saying that a municipality can't have their own Medicare plan now? No, I'm not saying that. Medicare plans are usually offered to retirees and not to active employees. Active employees older than 65 would be on your regular healthcare plan because they haven't retired. Does that answer that question? No. You want to, do you have a Medicare plan for active employees? Ah, all right. Why don't we go offline for that situation and we'll walk through that situation and what you're offering, and I'll follow up with you directly. Okay. Thanks. All right. I've written that down. Okay, any other Medicare questions? Okay, great.
Yep, and this slide we kind of touched on a little bit. So like Ewan mentioned, we would generally say if you're actively working and you're on the actives plan and you turn 65, MSP applies, or Medicare secondary payer would apply, and the plan through the consortium would be primary. Now, once we retire or transition to a retired status, that primacy generally flips. And there's a lot of moving pieces with Medicare as far as Part B penalties and HSA eligibilities and things like that. So it's important to do the research, and we can help you as best as we're able to. But those are two of the biggest things. Actively working, age 65, Medicare pays secondary if you're on the actives plan, but once you flip to a retiree status, then Medicare becomes primary. So I think we're okay with this slide. And then on our website, we have it linked over to the healthconsortium.net website as well, but on the Excelis website, we also have the group maintenance guide here. You can go to our employer homepage, and on the right-hand side under resources, you'll see highlighted there in the blue rectangle, a group maintenance guide. And once this new version gets updated, it'll be posted to our website, and we'll get a version over to you for your website as well. And that's really where we have all this information written out, and it's kind of, our one-stop shop as a guide, on how to handle certain situations and respond to inquiries that you might receive in the office. But with that, I think that's all I really had. The rest of the slides were just some images of some forms, so nothing that we need to really take up time today. So if you have any questions about additional forms that might need it for certain situations, feel free to let us know. But thank you, everyone.
I'm going to just show one of the things we've been referring to where you can find it. So there's a lot of useful information that Eric just spoke about in the Excelis Administrator Guide. So once you're on the the consortium website, you click over here on Municipal Resources. The Excelis Administrator Guide is right here. And we have referenced this several times throughout the presentation. It is a pretty robust document, as you can see from the index, but a lot of the eligibility questions we talked about, a lot of the COBRA information that we spoke about, where to contact people, is all on this all in this document. These documents are available in hard copy, and we will send you one if you are interested in having a hard copy, especially if you're moving from one location to another and you want to make sure you always have this Bible with you. But always the most up-to-date guide will be on our website. So as Eric said, once Excelis updates any of their information, including the group administrator guide, Beth sends it to me, and then Michelle Coco updates our website and puts it on our website. So this is a great guide for you if you haven't been using it, to continue looking on the website and trying to find that information there. Okay. So with that said, did you want to go through these forms at all, Beth?
I think we're okay. Those are just, if you needed to download a disabled dependent certification form or a qualified medical support order form or disenrollment, those are all on our website. And Beth and Terry can also supply them too, but they're available for download on that form section of our website. So if anyone has any questions.
Okay, I'm not seeing any
Well,
right
let me
now.
bring it back. My fax isn't working, so.
If anyone does,
Okay.
oh,
All right, thank you.
all right. If anyone does have a question, let us know. We'll also have questions and answers at the end if you think of something as we're going forward. So one of the things we want to talk about pretty quickly and briefly with you is our wellness program and things you can expect to be happening regarding wellness and our wellness program. So the Joint Committee on Plan, Structure, and Design is now the committee where we talk about wellness and we plan all our wellness activities and other events regarding wellness, including communication. And let me just say thank you, Eric. I'm sorry I cut you off without saying thank you. We'll come back to the rest of the Excelis team a little bit later, but thank you for joining us, Eric.
Thank you.
So all of you are invited to join us at the Joint Committee, and anyone in your location who is active in wellness and wants more information on wellness, this is a committee where they can feel free to attend. Most representatives that attend the Joint Committee are either the director or the benefit administrator for a location, and all the labor representatives on the consortium attend that. That's where plan structure, so all those resolutions we spoke about earlier are discussed, but it's also where we come up with our calendar for wellness. So we have monthly themes, and as you know, Deborah sends out each month information. Last month, she was sending out information on immunization, be wise, immunize, and then that continued through with the PROACT clinics and getting your flu shot. Because of all the events recently, we're a little late on October's theme, mostly because I have been busy doing other stuff, but Deborah's waiting to send out some of our next materials, which include both men and women's health, and we'll go into smoking cessation and diabetes awareness. So there are always some themes along with that. Some of the things Jason Warshall from Excelis is going to be talking to us about is ways that you can access your benefits. So Corey already went through the PROACT website and app, and Jason will do the same for Excelis. We'll also tag those onto wellness programs. And Jason will talk about some of the healthy behavior activities that you can access, the Blue 365 and things like that. So we'll throw that in under the wellness umbrella. Coming up soon, and Jason will give a little more information on this. Last year, we did our first Maintain, Don't Gain challenge, and it's to help people to be aware of continuing healthy behaviors, even through the holidays when it's most difficult. So we first have that Halloween candy coming up, and then we go straight into Thanksgiving. I'm sure many of you have already been drinking your pumpkin lattes, but that'll start going into pumpkin bread and pumpkin pie and everything else with turkey and stuffing. So the program is not about losing weight over the holidays, but it's ideas of how you can maintain and you don't gain. And we will put a little challenge out along with that. We will have some prizes along with that, and there will be some more information coming out on that. Jason's going to give us background as to kind of where the program came from, but we dabbled in it last year and we'll come out a little bit stronger this year with better prep time. And then coming up next is Jason helping us with digital materials. But I do want to let you know that when we do a wellness flyer, we then post it on the consortium website. So under the employee retiree wellness tab, there you can go and pull those documents back up again. So that's always a place where you can send people and give them that resources in addition to the flyers that have come out. So with that said, I'm going to turn it over to Jason for his presentation regarding well-being.
Hi, everyone. My name is Jason Warshaw. You want me to go on camera, or do you want to focus on the slides that are in front of everyone?
That's up to you, Jason.
Right.
I have to use the big screen because my camera's on my small laptop and I can't see what I'm doing. So.
Okay. We'll keep the concentration on the slides. So first of all, Elin, Greater Tompkins, thank you everyone for giving me the chance just to run through some things regarding well-being. I know that it's been really building over the past year since I've had the opportunity to come in and be the consultant with Greater Tompkins. So I am the well-being consultant at Excelis, just shy of 3 years, and wanted to run through a navigation piece followed by a quick tutorial at the end here. So if we want to go to the next slide, please. There we go. All right, so here is some of the concepts that the consortium along with Excelis have really been focusing in on. So 6 essential elements of well-being. Obviously taking into consideration all these different pieces that kind of fit the person, fit the member, fit the patient, understanding that, everybody, especially during this time, there's a lot of things that are being factored into our daily lives, our daily career, work lives, but we break it down like this, and we try to set up certain initiatives, hence the well-being calendar that Elin mentioned, but you can see career well-being. So what is it that, members and employees of different municipalities are doing every day? What are the social well-being pieces as a lot of us have gone virtual. So understanding some of the relationships that we have and interactions that we have with our colleagues, our family members, our children, our dependents. And then looking at what's going on in your communities. What's the engagement that you have? What's it like on an everyday basis? Your physical well-being. So this is something that many of us, and it was good to hear about how many of our members in the consortium, there's a lack of going to the doctor, and how can we boost that? So I think you'll see in some of the upcoming slides information on how to navigate to those pieces, and really all of these essential elements. And then we finish up with financial, and then a big chunk of this is our emotional well-being. What's our stress level like? What's our anxiety? What are we facing, like I said in the beginning? So this is our foundation. We are building our strategies off of this, and you'll see as we go on to the next few slides. Next one, please. So what I enjoy this graphic. I think this is a good representation of how we at Excelis and the consortium want to kind of piece in the various resources and tools that every Excelis member has. So we'll start off at the web or mobile site. Again, this is a critical access point to know that you are up to speed on everything you need to know about your health insurance with Excelis. we want you to be able to access both, right? So we are constantly going, we're in virtual, you have a smartphone, do you have that? And that is one of our questions, that's one of our strategies, and trying to assist those consortium members that may not have them, how to access those tools. And again, that's a great start place. Also, you have your benefit circle. So understanding what your benefits entail. We've heard a lot of that in our discussions up until this point. But being able to see it in front of you, being able to self-service it, being able to see, what you are spending your money on when it comes to health and health insurance. Our care management piece, right? So, you have certain conditions that you may be managing, how to access our team of care management specialists throughout, as well as those various tools and resources. And again, we'll break down each one of these as we progress through the rest of the deck. I think Beth mentioned looking at what medical costs might pop up, or what you can look at as far as like shopping around for different types of treatments, et cetera. So where to find that, how to estimate what you're going to pay when it comes to your health insurance and healthcare and receiving healthcare. Member card, right? So this is something we want people to have. Hopefully you have your hard copy in your wallet or your purse. If you don't, the mobile app is a great way to be able to pull that part up. So we'll show you how to access that. Prescriptions and mail order. I'm glad that ProAct was on the call, and I think they have some great resources. So we'll kind of defer that to ProAct. But when it comes to prescriptions, as part of your physical health, if you do take medications, are you taking them regularly? So we have some resources, and I'm sure ProAct does as well, on how to do those and take those in a timely manner. Again, encompassing that physical piece. Health and wellness, we'll navigate the health and wellness tab. We'll show you some resources as mentioned. Blue 365, we'll share where to find that and how to register for it. And then finally, the last two here, this is your provider piece. So finding a doctor, right? Many of us, likely we do have a primary care physician, our family does. If you don't, where can you go to find one? I'll share it with you. And that is a critical step. We want you to have a relationship with a physician so that they can be part of your everyday life and healthcare. And then finally, telemedicine. Hopefully, many of you have heard of telemedicine or have maybe used telemedicine. We'll cover specifically on MD Live, and we'll show you some of those toolkits that you have access to, or maybe you have access to telehealth service with your own provider, and again, very critical to that. So all these things wrapped around you as consortium members as having Excellus health insurance. So it's kind of that all-encompassing piece. So if you want to go to the next slide, please. So again, this slide deck is available to everyone, and we try to really take an approach where many of these tools are easily accessible by you once we finish today. So for example, if you wanted to take a tour of what the mobile app or member online account looks like, you can actually hit control and then hover your mouse around it, and it'll take you to video. It'll take you to our login. So again, easily accessible for you, for your municipalities and members that are there. How to download the Excellus mobile app, where to navigate in iTunes. And it was mentioned before of how to take this stuff on the go, right? Most of us all have a smartphone, and being able to pull it up very quickly and right then and there. Like I said, the find a doctor, there's a video tour. Telemedicine, there's a video there as well. So a lot of our work with well-being and the wellness committee at Greater Tompkins, has been able to take these, focus in on them, how to access these tools and utilize them, right? They're for your own good, right? They're pieces that I think are critical to everyday life. We'll also share with you WellFrame. It's a similar app, a partner app that we have chosen to use. In this case, you can engage with our member care management team to help provide you with various personalized support. There's that track medications piece, manage your medical conditions, as well as a testimonial video. So again, all this is available to you, and we want to help you to deploy it to your staff. Next slide, please.
Jason, I want to interrupt you for a second here. We had a lot of discussion at our meeting last week with the larger groups regarding the Excelis app, deductibles, HRAs, and high deductible health plans. Please note that when you are on the Excelis website and you are getting deductible information, out-of-pocket and deductible information, it's only for Excelis. So one of the things that I hear often is my employee is maxed out on their HRA card, but Excelis is saying they haven't yet, that they haven't hit their deductible. Why is that? You need to work with both Excelis and ProAct in conjunction. If you have had prescription drug claims, they are not showing up on the Excelis website. You have to go over to ProAct and the demonstration that Corey showed us and add the costs you've already had through prescriptions to your Excelis deductible to come up with the total. So that's why there is a difference between the two. So please remember, we have a pharmacy benefit manager as well as a medical benefits manager, and those two expenses need to be combined. They are currently not combined on the Excelis website. So that's important. The other thing about the app, we've talked about family members that are on your plan. Some of you have young adults that are on your plan and don't live in your home, and they're constantly asking you for their ID card because they need to secure services. If they download the mobile app, there's an ID card right there for them. They never have to call and bother you again. So that's a great push for your family members who are needing care to make sure they're going ahead and downloading that as on a regular basis to have access to their health plan benefits as well.
Excellent. Thank you, Elin. Here, just a little bit more in depth of what the Excelis Blue Cross Blue Shield website and mobile app entail. So you have right up front, and I'll show you this when I get into the tutorial, but based on the type of health plan that you have, you can find these things all up front. And again, this has many impacts on our daily life as far as, you know, spending, what our financial situation is going to be, what our coverage is going to be. So it's all right there. And again, similar to the website, I have the Excelis mobile app. I use it pretty frequently, but I can track all these different things on it. So next slide, please. Telemedicine, one of my favorite things to discuss. You know, as far as in 2019, we helped launch the behavioral health portion of it, but telemedicine is available with the partner MD Live. They are available 24/7, 365 days a year, on-demand access to board-certified physicians anytime, anywhere. And again, this is the acute care piece. So typically, as you know, we've entered this pandemic, we have seen a pretty significant increase in use of telemedicine with MD Live, but certainly we want you to be able to, and what does this do? So this increases your access to more physicians. Maybe your physician is not available. We don't want it to take place of the relationship that you have with your physician, but again, it's really increasing our access. If you have dependents, if they're away at school, if they've gone back to school, they also have the availability to access MD Live. And what I'll do here, if you can go to the next slide, please. So with MD Live, there is a registration process. I know, and hopefully some of you on the phone have accessed it or have tried to register, but certainly we would be able to assist you in that. There's a couple different ways that you can register via telephone. You can actually download the MD Live mobile app right on your smartphone or tablet. Or you can actually, a new function is to text the word Excelis to 635-483. And they can help, and the chat bot, her name is Sophie, she can actually walk you through the registration. Critical to registering for MD Live, you will need your handy dandy subscriber ID card, entering the 3-letter prefix prior to the completion of that registration. And the other thing here, I mentioned the word telehealth, right? So if you have a primary care physician, maybe you, over the course of the last couple of months, have had a telehealth visit with your physician. If you have, that's excellent. That's something we are definitely seeing an increase of as well. If you are unaware that they have it, certainly check with your primary care physician to see if they offer telemedicine. And you'll see in some of the pieces later on that there are toolkits, there's ready on-demand pieces that you can use to deploy to your staff, to any Excelis member. Next slide, please. Here we go. So here's your telemedicine toolkit. This is ready to go. There are ready to send emails. There's video clips. There's posters. I know we thanks to the help of Deborah, we've sent a lot of this information out. Hopefully you are familiar with it. Hopefully you've seen that. But we have quick video links. You can how to use telemedicine. Have you tried it? You know, the obvious piece of not wanting to go into the emergency room to have an acute visit to help. Maybe you have flu-like symptoms or poison ivy, but there's all sorts of acute conditions that we recommend using MD Live for. And again, avoiding further illness, avoiding going to the emergency room, especially today. So this is available for you. I know we have worked significantly on providing these pieces out. They are available at excelisforbusiness.com, and we also have this toolkit. We would be happy to get it out that way. Next slide, please. Member care management, so critical to your care. You also, through Excelis, have access to our member care management team, all sorts of healthcare professionals that can help in a wide different variety of specialties to help provide you with one-on-one support. I think critical piece is behavioral health. You have access to our behavioral health team, our behavioral health management team, and you can see, I'll point out the 2 numbers in the lower right-hand corner. So any type of chronic or complex conditions that you may have, you have our member care management team accessible at your fingertips when you might need them. So complex condition management, oh, sorry, go ahead. WellFrame is a way to connect to our care team. It's another app. So you all have access. There's no charge to use the WellFrame app. There's a lot of great information on here, and I'm going to continue to kind of hone in on the mental health piece. There are lots of different tracks, pieces of information that you can use. It'll help you with daily reminders, medication reminders, again, accessing our member care management team. You can learn about a diagnosis, manage a certain condition that you might have, as well as maybe asking some sort of clinical questions that may pop up. So we have in the next frame, I'll show you, there's similar to telemedicine, there is a WellFrame toolkit, but it's actually not on here, but it is accessible through Excelis for Business, so we can make sure we get that out to the folks on the phone. Next slide. So Blue 365, again, we'll show you in the tutorial. I know I'm holding everyone back from lunch, but we'll make sure we get you through that. So you do have to register for Blue 365. So it's almost like I'm giving you all some homework to do today to sign up for these things. We're here to help you kind of navigate through those. But Blue 365 is a way to get some handpicked deals. I receive them weekly. There's discounts on all sorts of health categories that are available, and we'll show you where they exist. There's exclusive offers. There's year-round discounts. There's typically no setup, and again, this is free for those at the consortium. Next slide, please. As mentioned, Elin did talk about the Maintain, Don't Gain kickoff. So that is coming out very soon. Typically, we will be rolling this out in the coming weeks to provide, certain aspects of health when it comes to managing weight during the holiday season. So really, our kickoffs have gone Thanksgiving through New Year's. We provide a 6 to 8 week program, to encourage good eating habits and maybe think of some alternatives during the holiday season and how to incorporate some better physical activity pieces that you can do throughout the entire holiday season. I think if you look at weight gain and adopting certain healthier lifestyles, it can decrease your risk for chronic disease, cardiovascular disease, diabetes, as well as other health lifestyle related illnesses. So as mentioned, so the Texas Department of State Health Services, they were in kind of building this program. It is available in its original form through the CDC. So we'll be providing that. So the program itself will have an overview of the Maintain, Don't Gain program. We'll be rolling out the getting started piece and timeline for Elin and for the Wellness Committee. We'll be doing a way in and way out log, as well as before and after surveys. Certainly there's exercise and a fruit and veggie log. So making some improvements, small changes to your everyday health. There are also weekly emails that you'll see that'll come out, and I've been providing Deborah with some of those on the diabetes side and some of those on the flu and vaccination side. Next slide, please. All right, so what I'm going to do now, Elin, are there any questions in the chat box? Does anybody have any comments or anything they wanted to share while I'm going to pull up my Excelis account, and then can I take the reins from you, Elin?
I think you should be able to share.
Okay. Can you see my screen?
Yes, we can see it.
Perfect. So before I log in here quick, I'm going to also have a quick plug for our Making the Most of Your Health Plan. We actually have live Making the Most of Your Health Plan where we cover this piece for your staff. They're typically during the lunch hour, only about 25 to 30 minutes. We run through how to make the most of your health plan, how to find these resources. We also do have a recorded link that is available for any of those that are interested. So if that is something that some of the folks on the phone would be interested in, I have a calendar. We have it planned out for the rest of the year. So please feel free to contact any one of us. So what I'm going to do now is, so if you did not have an Excelis account, you would click either login or register, which I would do. But first, I'm going to hover over the coronavirus COVID-19 piece. So right up front, right on our website, you have access to it. You can click it up, and there's all sorts of resources on being safe during the COVID-19 pandemic. So please feel free to self-serve and check it out. There's some good stuff on there. So I'm going to log in. I am a member. I am registered. So you will have to bear with me while I click the login piece, and it will pull up. Now, please remember that this is my own login. My health plan might be different from those on the phone. So what you're seeing is what I have access to. So as it loads, right up front, it'll tell you what your health plan consists of. I am the Healthy Blue Copay, of which right there you can see my name. You can see paperless settings. There's the view statements that you can check through, my subscriber ID card, and then it says member cards. That's where I can go to order more if I wanted to. I'm going to scroll down quickly. I want to show you this kind of slide bar. So in network, it will show me up front of what my copays are going to be. So for an office visit, primary care, my copay is $15. Office visit, specialist, $25. Urgent care, $25. Emergency room, $150. And as I scroll over, eye exam routine. So these should all be up front. If you have a high deductible health plan, you would also see your current spending, where you are in regards to your current deductible of meeting that. I'm going to go back up top. The My Account feature here. So you can more specifically view benefits and coverage, view your membership cards, manage your plan, change your doctor, specific information about, your basic information about your address. You can view your statements and documents. So again, this is all right there. And I think it would be great for anybody in the consortium to, assist somebody in finding these things. This is all self-serving. It's all right here at your fingertips, anytime, anywhere. Claims, here you would search for, certain claims. Maybe you're waiting on responses. You have them. I'm not going to go down because I don't want to show you my claims, but this is where you would be able to search them for you, for your family members, etc. The prescription piece, I'm going to jump over and defer again to ProAct. The Find a Doctor tab here is where, I don't have a primary care physician. Here's where I would search, right? So again, trying to figure out, if there are consortium members that don't have a doctor, where can they go to find one? Because we want them to have a primary care physician. So I would begin my search here by clicking Start a Search, and it will pull up based on, your location, based on where you are currently to find a doctor. I won't go into the search. I'll keep it simple. Again, all up front. The Health and Wellness tab here, again, some of this might be a little bit different for what you are seeing once you are logged in, once you are on our website or mobile app. And critical, your website login is the same as it would be for your Excelis mobile app. So you can access both with the same username and password. So keeping it in line. What I wanted to focus in on here are a couple different things. I'm going to skip over the 24 nurse line as well as health risk assessment, but I'm going to go right to Blue 365 discounts, as we mentioned in the deck earlier. And let's see, where do we go? So what is it doing here? Bear with me. Technology. And it's not going. Right there it is. So here's where you would sign up, Blue 365, and it's, for some reason it's not advancing, so I apologize for the technical difficulty. So let's try another category. So I'm going to click on preventative health. When it comes to screening, I know Elin mentioned some of our screening guidelines for October. Here you have at your fingertips of staying healthy at every age. Know your numbers, know your A1C, know your cholesterol levels. Hopefully you are getting those types of screenings, whether it be through your doctor or the like. You have at your fingertips health tools. So these are all here. And again, these are a lot of the different conditions and things that are typically we think of as preventative health. We want you to get these types of screenings regularly when you should, based upon your age. So you can see the various categories. They are all right there. I'm going to actually try to go back to Blue 365. Being cranky. There we go. So here, again, you have discounts, right? So you can search everything from, active wear to, discounts on gym memberships to, there's Fitbits. It all really varies, but you can search by specific categories. So apparel and footwear, fitness, hearing and vision, home and family, and these all have various things. So currently, right now through Blue 365, If you go down, there's some discounts you can see on what's available. You do have to sign up for it. It's relatively easy to do. You have savings on hearing and vision. There's fitness, so some virtual online health and wellness classes, so you can save on those. Glasses.com, there's a current savings there. Again, Fitness Your Way by Activity Health. You have $29 monthly access fee for access to network of over 10,000 plus gyms, etc. So that is the quick version. Also in health and wellness, managing conditions. This is your care management piece. So if you have prediabetes, how can you help manage that with you and your doctor, with your specialist? You have mental health and substance abuse. Again, it's coming up and more apparent in today's climate. So that is their care management with WellFrame. I'll click on this quick. And here is where we can navigate members to. The WellFrame app is found on the App Store as well as Google Play, and you can see some of the screenshots. So we want members to use these. We're here to be of assistance in guiding them through them. And this all kind of ties back to your everyday well-being. So we are coming up at the top of the hour. What I wanted to do, Elin, are there any questions in the chat box?
No, I do not see any questions in the chat box. And I did want to let this group know that we'll be going over a lot of this information in a little more detail at the next joint committee meeting at the beginning of November. Some of the attendees of last week's meeting and probably tomorrow's meeting will not see this same presentation. And so we wanted to make sure everybody had access. I know recently I've been receiving a lot of questions on the Blue 365. There is the discounts that Jason has just showed us, some other things involved with that section that are free, free resources and discounts on programs. And so certain municipalities, while everybody's, bemoaning the fact that they're home and they're stuck in and they can't do this and they can't do that, how can they remain healthy? How can we as employers give some incentive to try something new and try something different? And some employers have been using the 365 as, hey, did you know your health plan had more to it than just the copay you pay when you go to the doctor? So I think these are all great resources, and Jason will have the opportunity to share more with you at the joint committee. I'm sure he could show us a ton more right now, but we are running out of time. So before we do run out of time, in the 1 minute left, I did just want to ask if there was any questions, lingering questions, and to let you know that after this meeting, we will be posting the presentation in YouTube form. All of these presentations are being recorded and will be posted on the consortium YouTube channel. In addition, the 3 different presentations will be posted on the website, and then we will also hand out the decks through email once all 3 presentations have been done, and the last one is done tomorrow. So we will continue to push out information to you regarding these resources, and we will continue to do that on a monthly basis as well. So with that said, thank you for the thumbs up already. Is there any other questions at this time, or anything we missed that we should have covered? All right, I'm seeing some thumbs up that we covered everything. But if there's anything, after you eat your lunch and get some coffee, if you do think of something, please email myself or Deborah Meeker, so E. Dowd or D. Meeker at the consortium, and we will go over it in more detail with you. I know we have to get back to Darcel regarding the Medicare plan for active employees, and I will do that soon. I do have back-to-back meetings today, so I may not get back to you immediately today, but I have a little more flexibility tomorrow. So with that said, there is one person on the line that's been pretty silent for the whole meeting. We do have Rob Spinard from Losi and Cahill on the line. And he was here to help us with difficult questions as they come up. As you know, Losi and Cahill have been our consultants since the beginning and have been very instrumental in helping us secure the administrators that we have that help us roll out our plans. So a big thank you to Rob for being on the line in case we needed him. And then to our partners, ProAct, Corey Prashaw and his team. And then to the Excelis team, to Beth, Eric, and Jason for sharing your time with us this, oh, Terry also. And then from the consortium, Jessica sharing about our invoicing and counting procedures. And then to Deborah for putting this all together and making it happen. Before we hang up, we cut off the meeting. Any last questions or concerns? If not, thank you very much for joining us, and we look forward to speaking with you soon.
Thank you, everyone.